My name is Brandon Gaffney, and I'm the President and Chief Executive Officer for New Horizon Family Health Services. The mission is to provide quality, affordable, compassionate, patient-centered care so that we can improve the health and lives of those in which we serve in our community. New Horizon Family Health Services serves everyone, regardless of their ability to pay, which includes the insured, the underinsured, and the uninsured. And the reason we're here is because there are catchment areas across the country, especially locally here in the Greenville area, where we have underserved communities that need primary healthcare services and no supporting services. We provide pediatric services. We do behavioral as well as medical assessments, well child visits, immunizations. We provide internal medicine and family medicine services. We see all adults. We monitor patients who are healthy and want to continue to be healthy, as well as those who have problems or issues with diabetes and hypertension. We also provide dental services. We have a full service standalone dental site. We have 3 special programs: Ryan White Early Intervention Services. We have a Healthcare for the Homeless program, and we have a mobile medical team. Our Ryan White Early Intervention Services program is a program dedicated for those individuals who've been clinically diagnosed with HIV, but don't have the wherewithal to pay for primary care and other medical support services. Then we have our Healthcare for the Homeless program, which was established in 2005, and we go throughout Greenville and surrounding counties to make sure those homeless individuals have a medical home. And then finally, we have our mobile medical team. This team, due to lack of brick and mortar and the high cost of providing those facilities all across the county, we have a mobile medical unit that goes throughout Greenville to provide services to those individuals that need primary care and they need the care to come to them. What we do to the local healthcare system is provide a facility for individuals who need health care but may have a financial issue in paying for that health care. So we meet patients where they are financially. We have a sliding fee scale that we use a person may have to pay full pay depending upon their income and household size, or they can get a 20% discount, 40%, 60%, 80%. And if they're below federal poverty guidelines, just a nominal fee of $15. The impact of that is this past year, we were able to see over 20,000 patients and provide 83,000 patient visits. That's phenomenal for this area.
My name is Doris Wofford. I am the board chair for New Horizon Family Health Services. Back in 1992, we knew that there was a need in our community for quality, affordable health care for so many people in Greenville. So we started out in the basement at Greenville Memorial Hospital. After we were there for a good while, we knew there was a lot more of our community that was in need. We have 3 different offices right now, locations. One being the main office located on Ferris Road, right across the street from the hospital. And we also are in Travelers Rest and in Greer. And we are just breaking ground on a new facility in Berea off of Whitehorse Road. And we also have a dental office as well.
My name is Jason Evans, and I am the Healthcare for the Homeless and Medical Respite Program Care Director. The Healthcare for the Homeless program, there's only 10 of us on a good day with providers, so we really try to focus on the healthcare aspect, treating our patients. So the housing, food, clothing, job applications, disability applications, all those we kind of leave up to the other providers that focus on those. We work with a number of providers, Miracle Hill Ministries, Salvation Army, Triune, United Ministries. I'm going to leave a lot out. So right now we have 13 site visits that we take our 2 mobile units. The patients can be seen in the office. Majority are seen on our mobile units because we like to take the care to them. In 2019, New Horizon partnered with Miracle Hill Ministries to open the first medical respite for the homeless in South Carolina. We have 6 beds there at their men's homeless shelter. And in 2022, we partnered with Miracle Hill's women's homeless shelter, Shepherd's Gate, and we have 4 beds there. So now we have 10 beds total. We're still the only medical respite for the homeless in South Carolina. Hopefully that's going to change in the next few years.
My name is Minda Shelton. I'm the director of Shepherd's Gate. We are a homeless shelter that serves ladies that are in the upstate of South Carolina, and they're single mothers, mothers with young children. In 2005, the bus came and started working with us, and then we got the respite room, which I didn't think I wanted. I really didn't. It was one of those kind of things when they said, you're going to have a respite room. It was like, oh my goodness, okay. The mission had one. It was great. I just didn't know how it was going to work here. But once we had it, it has been absolutely awesome. We just have had, sometimes we had the room full one time with 4 elderly ladies. It was so much fun. They were funny. It was a lot of fun. And we've had them come and go along the way. And every one time when they come, I just feel like I am so grateful we have this room, because I don't know where they'd be. I don't know where they go. And so we're really grateful that it's here. So when the team of New Horizon finds somebody that needs it, we can offer that to them. And it's just awesome to do that.
I am Dr. Deanna Cotter. I am the Chief Medical Officer, and I am a family medicine physician. My husband and I are both family medicine physicians, and he was looking for loan repayment. In 2001, we came up to Greenville, and we both started working here at New Horizon. So patient-centered healthcare means focusing the care on the patient as a whole. We do that here as a team approach. We start with the medical care, where we use medical guideline recommendations to provide the best care for the patients, which improves quality of care. Then we use behavioral health. If we have any behavioral health issues, we integrate our behavioral health providers. We have care advocates that assist with social needs, and we have pharmacists that help us with medication. And helping patients with understanding why they're on medications and how to take them helps us improve health outcomes also. What's most meaningful to me is feeling that I'm making an impact on patients and their families. I have 3 generations of patients now, where I see the mother, the father, I see their children, and now I see their grandchildren. And I find that we get better compliance, we build a bond, they have trust with me, and I really get to know all of them as a whole. And by making the patient better, makes their family happy, because a healthy person is a happy person.
My name is Ashley Pedigo. I am the Chief Dental Officer here at New Horizon Family Dental Care. So at our dental clinic, we are currently offering comprehensive oral examinations, including oral hygiene instruction and individualized home care plans. We're performing simple and surgical extractions, including some case-selective third molars or wisdom teeth, for which we use our wonderful equipment, things like our 3D panoramic machine to see images in a better diagnostic view. We have big plans in the future to expand our services to include crown and bridge with wonderful things like 3D printing. So we're really excited about that. And we really rely on other partnerships as well, grants and other programs like Ryan White Aid Upstate and Healthcare for the Homeless to be more supplemental support for patients seeking services here, and also for some of those other specialty services as well. So I think New Horizon does a really good job of really supporting patients coming full circle in their oral health endeavors.
Hi, my name is David Hogg. I'm a member of the board and also a patient at New Horizon. I have been a patient for probably 8 or 9 years. I first came to New Horizon actually looking for a provider for my brother who had Medicaid. Very hard to find a good Medicaid provider. And so introduced him to New Horizon, came in with him though, kind of get a feel for things. Met Dr. Cotter, who is actually our chief medical officer now. Her and her husband work at the Travelers Rest branch as well as elsewhere. Just wonderful folks. I was very impressed. Impressed to the point that actually I joined, my father joined, my mother joined, sister, brother-in-law, and brother joined. So we're firmly committed to New Horizon. We've experienced it ourselves. Wonderful quality health care. The quality of care starts from the top with Mr. Gaffney, and it goes all the way to the receptionist that people meet. There is an environment of helping people here. And then as far as the quality, the doctors are so professional, but you know what? They're also good people, and they care about the patients that they have. They have all the abilities to provide the care that you need in a professional, but a very friendly and compassionate way. I had been a patient for 5 years at that point and had gotten to know the organization, had gotten to know the people in the organization. And when I was asked, I could not have been happier to join because I knew what I was joining. An organization that cared not only about the regular type patients, but also those who were in desperate need. And when you come into New Horizon and you sit in the patient's room, you see people who maybe don't have another alternative, but they're finding that alternative here. So it's a wonderful organization. There is a great feeling of caring here.
I'm Latina Karpinski, the Public Affairs, Marketing, and Advocacy Director here at New Horizon Family Health Services. So our motto here at New Horizon is quality healthcare for all people. And we really mean that, all people. We want to make quality healthcare accessible regardless of what you look like, where you live, how much money you make, or what language you speak. We just want everybody to come in and get the healthcare they need. So we try to help remove barriers to care that will keep individuals and families from coming in and taking control of their health, because we know that if you have difficulty maintaining your health, that can bleed over into other areas of your life. And we also know that when people and families are healthier and stronger, it's better for us as a community. Now, in order for us to be healthier and stronger as a community, I think it's important that we take care of the most underserved among us, which is why the special programs at New Horizon, like the Ryan White program, which is for HIV treatment and prevention, our healthcare for the homeless and medical respite care program, and also our mobile medical team, which goes out into the community to meet people where they are and bring those healthcare services to them. These programs are extremely vital. Also vital is having staff that can speak to a patient in their language. We have medical interpreters and translators, and also other interpretation services, again, because we want to make sure that people can understand what is going on with their health. Also vital are the connecting services that help reduce or remove barriers to care, like food insecurity or financial situations, or even transportation, which is why all of our clinical sites are on city bus routes, because we want to make sure that people can get to us. If they can't get here, they can't get healthy. We also can't do what we do at New Horizon without meaningful partnerships and connections, and we have so many of them throughout the community. I like to think of these folks as our village, and you know, some of these folks are doing great work in their own right. Partners like Miracle Hill Ministries, United Ministries, Sustaining Way, the Hispanic Alliance, and so many others. So I feel so blessed to be a part of an organization like New Horizon Family Health Services. I have several family members, including my mom, who is a patient of a community health center, and I am so grateful for the way that they take care of her.
My name is Joe Yamina. I am the lead pharmacist for all 3 pharmacies at New Horizon. Well, we filled our first prescription on January 1st, 1998 with one pharmacist, Dana, who is currently still with us after 26 years. She's the pharmacy services director. The unique thing about having a pharmacy in a community health center is that we are eligible to buy drugs at a reduced price with the federal program. We offer a patient-centered approach where we always focus on the patient. We could supply meds to patients at an affordable price, and compared to the big box retailers, we also have the staff and resources, and we have interdepartmental corroboration to focus on patient care. You could actually witness the health outcomes of our patients, and it's very satisfying.
I think I can speak for my whole team when I say it's a calling that we didn't know we had until we started doing it, and now we can't imagine doing anything else. I don't know how to explain that.
Community health it's always been where my heart has been drawn in dentistry. And then New Horizon in particular is just such a staple of the community. And they're really doing the work to really carry out their mission and provide affordable, just quality healthcare. So yeah, to be able to do what I love and do it in such a wonderful clinic, which also serves the community where I grew up, it's really rewarding. Doesn't get much better than that in my book.
This work is important because it started long before I was born. President Lyndon Johnson had a war on poverty in the 1960s, and that war on poverty created community health centers, or as some people term it, federally qualified health centers. And so our job, or let me say our mission and our movement, is to go to those individuals who need affordable quality health care and provide those services. That has driven me to be a part of this movement for over 20 years.
About 3 or 4 years ago, I was asked, I'm currently on other boards, and I was asked if I was interested into getting on to a New Horizon board. Well, I didn't know very much about New Horizon at all, so I did a lot of research. I wanted to know, is it going to be meaningful for the community that we all live in? So I did a lot of research and knew that what we do here at New Horizon is completely what I was raised, my morals, my ethics, everything of helping our underserved, the community that can't get quality health care other places. So once I did that research, I knew that it was a great fit. It's in my heart to help others as much as possible.
I was very happy to join because I knew I'd be part of working with good people to try to help other people in the community.
I feel like the work that we do here and what we stand for, it just feels right. It feels like it's the right thing to do, and I'm glad to be able to do it. It's truly a blessing.
Yeah, I've been here for over 20 years now, and I stay here because I love working here. I love working with our patients, and I love working with the New Horizon team. I find it very satisfying, challenging, but I feel like we're doing really good work with what we do.
I've been here for 10 years, and I absolutely love my job. It's the best job I've had in pharmacy. I used to work for the big box retailers, and they just didn't focus on patient care like we do here. I just love the whole mission of a community health center. And my wife, Suha, she's one of the clinical pharmacists, and she enjoys it just as much as me, and we have the same values, and she has the same satisfaction with her patients of the services she provides them. So we love it. We'll never leave here.